And so happy Friday, you guys. Today is July 7th. I don't know where the year went. And I'm sure Dr. Judy feels the same way because she is the hardest working retired veterinarian I know. This woman is on so many platforms, showing up everywhere. She is a best-selling author. She has her own products. She has a store. She has her university. You can't stop this woman, thank God.
Thank God.
So I don't think the word retirement's actually in her vocabulary. I think it's just shifting.
Yeah, I kind of wish. Some days anyway.
You're making such a difference, Dr. Judy. Thank you for being here today.
Well, thank you.
So today, this is the Cancer-Free Canine page. We interview people on their cancer win success stories, whether they're veterinarians or animal dog owners. So we've had some amazing dog owner stories of cancer successes, like Kelly Marin and her green juju creation over her situation with Bailey. That was amazing. If you guys haven't seen that, all these Facebook lives are in the guide section in the Cancer-Free Canine page, and then also on my YouTube channel. So if you're not subscribing to my YouTube channel, you guys can feel free to do so. It's Poppy Phillips. It's just Poppy Phillips. There's unfortunately a lot of Poppy Phillipses out there in Europe, but not
Really?
in California. I know. And Dr. G, I had like so much envy when you were live in Ireland or England.
England.
Oh my gosh. I wish I could have been there.
It was great.
It looked.
It was fun. I had no idea he was so tall. For some reason, I mean, I've never seen him standing up. And when I saw him stand up, I kind of went, oh my gosh, you're really, really tall.
That's the crazy thing about online.
Yeah.
You never know anybody from the waist down.
Nope. And I'm on the shorter side, like pretty short. So yeah, when he stood up, I kind of went, oh my gosh.
That's awesome. Yeah, I saw your little games and I was just like,
yeah,
huge fan. Well, Dr. Judy, what can you tell us about canine cancer, early detection, your success stories? What has worked? What hasn't worked? Take us down this journey of your whole life experience. You've been in practice for so many years. I'm sure you've seen some good, bad, and ugly.
Well, so I spent my first 10 years in practice as a traditional practitioner. So no clue that there was anything out there other than prescription diets and vaccines and a bunch of chemicals. So I sort of stumbled into becoming a holistic practitioner, not on purpose. And but the results that I saw, I started out with doing chiropractic care and the results were amazing. So just with that one tool in my toolbox, I said, oh, there's got to be a lot of other stuff out here. So I really started delving into all the different things that were out there. And what stuck for me was traditional Chinese veterinary medicine and particularly food therapy. And then I started getting rather well known in my local area because I was doing, some voodoo, black magic, whatever we want to call it. That was what my partner at the time was calling it. And he finally said, we have to get a partnership divorce. I can't be part of this because I don't know what's going on here, which it was actually almost comical because he had a practice and I was working for him. And this practice 5 miles down the road came up for sale. And the doctor who owned it was a homeopathic doctor. And at the time we were so traditional and we just used to make fun of him, and people would come up here with their little bottles with these little white, homeopathic balls in them. And we were just like, we don't even know what this is. We can't read his writing. We don't know what he's doing. And when he wanted to sell the practice, we were like, oh my gosh, there's black magic in the building, whatever. And so 10 years later, when I was doing all this different stuff, my bot or my associate partner, he was like, it must come with the building. I just don't know what you're doing. So we parted ways very amicably. It was great. And then I started getting a lot of referrals for acupuncture and food therapy and chiropractic and all the different things that I was dabbling with at the time. And of course, anytime you hang out a shingle that says I do alternative or holistic or complementary, because I'm an integrated veterinarian, I also use traditional medicine. I apologize for my voice. It decided to leave yesterday. So once people know that there's somebody like that that they can go to, and it's the same now. It's you get all the cases where people are at the end of their rope, where I've been trying to treat these allergies for 5 years, we're not getting anywhere. It's just round after round of antibiotics or steroids or whatever the chemical of the day is. People that were just really frustrated, people that were looking for something different. So we started getting a lot more really difficult cases. And cancer is one of those difficult cases where people come to you and say, well, I've tried everything, and we also happen to be fairly near a university veterinary school, the University of Pennsylvania. So they're very well thought of, they're very well known, and they can pull out all the stops. So one of my cases that came to me fairly early on in my holistic, and a couple of the cases that I'm going to talk about today are cases that came to me very early on, and I didn't know a whole lot. And there was this great website that actually I still love to go there and get information. It's called A Path with Pause. And I can't even remember which doctor it is, but she has basically put online all of her cancer information, and it's an older site. So this is stuff that she was doing using food and Chinese herbals and acupuncture from 15, 20 years ago. And so I would go to her site quite often when I was presented with something that I went, oh, geez, I haven't done one of these. So I had this little Cocker Spaniel that came to me that had mast cell tumors. Definitely vaccine related because they were over the shoulder blades and on the butt. Where do we vaccinate? Over the shoulder blades and on the butt, loin area. And so the owner was great. She had taken this little dog to the University of Pennsylvania, had multiple surgeries, multiple rounds of radiation, and the tumors, as mast cell tumors like to do, just kept coming back and coming back and coming back. And finally, they just said, there's absolutely nothing more we can do for this dog. And so she came to me, and this just happens so often. There's nothing more we can do for this dog. Okay. So she came to me and I said, I have no clue. I haven't dealt with one of these. Sure, let's give it a try. And we certainly weren't going to put the dog through any more surgery at the time. When she came to me, it had a pretty good sized mast cell tumor, subcutaneous, under the skin on the butt and also over the shoulders. But she was feeding dry kibble. She was doing all the traditional things. She was told, of course, the traditional veterinarians are like, oh, you still have to do your vaccines and be up to date. You still have to do your heartworm preventative, all the normal stuff. So I said, all right, well, first of all, we're going to take all this away. We're not going to keep throwing chemicals at the dog. We're not going to vaccinate the dog anymore. And I'm going to design a diet for the dog. We're going with human food. We're getting away from the processed food. And then I put the dog on just about every supplement I could come up with at the time. And this was way before we knew about detoxing for vaccinosis and a lot of the things that I would do differently now. So I just said, okay, what do I have sitting on my shelf that I can throw at this dog? So we did our homemade diet, which I think at the time it was pretty similar to my pup loaf, which we still use pup loaf a lot. So we didn't know about keto diets. So there was just a lot of things we would have done differently. And so I think I put the dog on IP6, artemisinin, Zhuefu Shuyutang, which is stasis in the mansion of the blood, omega-3s and CBD oil. And I said, let's see what happens. The dog was maybe 5 or 6 when she brought him to me. The dog actually died of old age at 16, lived through a house fire. And the worst thing was she came to me after the house fire And she had all of her supplements that she had just refilled. And she said, I don't think I can use these. And I opened the bag and every container just smelled like smoke from the house fire. I was like, I don't think we want to use these. Even like I opened brand new ones and I'm like, oh no. So we replaced all of her stuff for her. And she kept the dog on the supplements for that 11 years, from age 5 to age 16, when it died of something totally unrelated. The tumors never changed. They never got bigger. They never got smaller. And I said to her at the time, I said, look, I want you to have a conversation with these tumors on a daily basis. And I want you to have a conversation with your dog on a daily basis. And I want you to, and she was so in tune with her dog, and it was just her and the dog. And so she spent a lot of time, outside exercising, taking the dog, like really that mental stimulation. And I said, I want you to focus on the happiness of the day, not the grief or, because we all grieve. It's like we grieve way before they're ready to leave us, and we really can't do that to them or should not. And I said, I want you to tell the tumors that they don't have to leave, but they're not allowed to kill the dog, because if they kill the dog, they die as well.
Can I stop you right there?
Yes.
I'm so excited to hear this, because I also command and talk to diseases, and I don't know anybody else that does that.
I don't remember who I learned that from, but thank you, Joey. I could use that. I don't remember who I learned that from, but I do that a lot. It's I don't care. Like, one of my little dogs was just diagnosed with cancer, and I said, I made a protocol for him, and I said, I have no interest in killing the cancer. That's not my goal. My goal is to take my 15-and-a-half-year-old dog and let him live to be an 18. I told him originally he had to live to 27. So, but if I can get him to have months or years more of quality, he's so happy. He doesn't know he's sick. He runs through the house. He bounces. I'm like, I'm not going to tell him. And so, I made a protocol, and I'm like, well, I don't have a desire to kill the cancer. I just have a desire for that cancer to not kill my dog.
That's so amazing. I watched your Facebook Live on George's story too.
Yeah.
And you guys can also jump on Judy's platforms, multiple platforms. I don't even know where it was. I can't even.
It was at least on YouTube and Facebook. It may have been on Instagram as well. And unfortunately, when the graphic was made for it, they said Judy's dog George has been diagnosed with transitional cell carcinoma. We don't know that that's what it is yet. We don't have a diagnosis. I've been trying to get the urine sample to get the true diagnosis of a transitional cell. There's this test called a cadet BRAF, and it's a urine sample. So I finally got urine from him. So I finally got urine from the little guy, because, the tumor he's like 5 tumors in his bladder, and it's also down in his urethra and his trigone. So sometimes when he pees, 3 drops come out. He doesn't really strain, but he just, he'll just stop and walk 10 feet further, and another 3 drops come out. So I really struggled to get this sample. He went out, he filled the cup for me, and I was like, yes, I finally got the sample. Run it over to my vet office, and only one lab runs it. It's the Antec lab. And she said, oh, we have IDEX. We don't use Antec. And I was like, oh. So we're trying to, think, okay, should we call all the other vet hospitals in the area? Do I have to drive this sample from North Carolina up to New Jersey? And then our equine vet happens to be in the building right behind our dog vet. And she goes, wait a minute. Let me go ask them. Will they use Antec? So, oh, great. So she takes the sample back to them and gives it to them. And she sends me a text and says, test is $400. And I'm like, whatever, I need an answer. Right. So whatever. And then I got a text today that said, oh, they need it in a special container. Actually, I got the text yesterday. This will let you know when the container's in. So today I went and picked up the container. It's Friday. Nobody's open over the weekend. So they told me, I picked it up at like 11:30, and they told me I had to bring it back by 2:30. So really? I go home.
It's that hard. Like, this is jumping through hoops for this.
It is. And I need 40 mLs of urine. So that's a lot of urine from a little tiny dog who is giving me little drops and squirts. So
you need to do a sterile sample then?
Well, we don't want to stick a catheter up there because we got to go through the tumor. I don't want to make it mad.
Yeah. Good
So, which
point.
is why we're not getting a sample, going in and doing a biopsy. I'm like, I'm not going to make that thing mad. Like, let it sit there. So, so for 2 hours, my little dog and I walked around the yard, and he would stop, and, then he would put his foot in it. But in 2 hours, I managed to get 4 cc's of urine. I was like, this is never going to happen. So I didn't get it before the 2:30 cutoff, and I'm going to be away next week. So I'm like, all right, we got to wait another week and a half to get this urine sample. Then 10 minutes ago, my husband texted me and said, well, George just gave us a very large river on the kitchen floor. He's feeling much better now. I'm like, I bet he is. So I just need to catch him when he's in the mood to put that very large river in my little tiny cup. So,
Well, and I thank you for bringing up the BRAF mutation, because nobody talks about BRAF. I do, because I had a sister that died of melanoma, and BRAF responds very, very differently than other cancers. And in humans, you can't do keto diets. It actually feeds BRAF mutations.
interesting.
So it thrives on that, but I don't know if it's true for dogs. So please pay attention.
Yeah, well, I'm working with Dr. Kendra Pope, because as we all know, when your own animal is affected, you lose your mind. And this little guy, he's like one of my originals. He's one of my first rescue dogs. We've had him for 14 years, and he is everybody's favorite. Like, he's a little Muppet. He's just the best dog. And so, I'm really working hard at not freaking out. I knew something was wrong just by his tongue has been what I call toxic red for months, but I couldn't find the problem. So his last ultrasound didn't show anything. So I'm like, I can't find the problem, because as we all know, many, many cancers, there's nothing wrong on the lab work. Oh, look, it's pristine. His CBC chem, it's pristine. His urinalysis is pristine. Well, that's just great. So, and then I struggled to get the ultrasound. That we saw that story. So, but anyway, so Kendra sent me this really long list of tests. She's like, I want to know his vitamin D levels, his magnesium levels, his calcium levels. I need a hair analysis. I need the cadet BRAF. Like, there's his iron levels, like a million things that she wants. So I don't have a clinic anymore. I'm scrambling around trying to find people who can do all these things for me. And some of them are very specialized, going to specialized labs. Like, okay. So yes, I am jumping through a bunch of hoops, but I'm also not frantic. And this is another thing that for clients who have pets with cancer, like, I would have people come to me and I would be the 10th doctor that they had consulted with. Their poor animals would have been in and out of 20 different veterinary clinics, getting poked and jabbed and prodded and examined. And I get it. People are really looking for somebody. They're waiting for that one person who's either going to give them hope or going to give them a different answer. Like, and you go to 20 different people and you're hoping that at least one of them is going to say, there's hope, I can fix this, whatever. And you keep looking. And there were some people that they had been to so many places, and their dogs had been, or cats had been through so many tests and so many procedures, that I literally would take one look at them and look at the poor animal who's sitting in the corner going, just, I no more. Like, and I would say, it's a really nice day. The river is 1 block away. I'm not going to touch your dog until you go take a walk along the river, stop and smell the roses, and let them enjoy life for a minute. Like, so I'm not all focused in, I have to get all these tests done and get all these samples, and I'm going to be away next week. We can't get our urine sample. We didn't get it today. Okay. When I come back in 10 days,
Dr. Judy, I think that's such an important part. I see so much PTSD pet owners.
Yes,
and
absolutely.
It's escalating. I think with social media, with so much information, it's just causing this spiral of try this, try this, try this, try this.
And you get frantic. And I'm in the process of writing a book right now. And it's sort of like, okay, well, your dog has inflammatory bowel or leaky gut. Well, here's a whole list of things you can try. please don't give them all at once. Like, don't take this entire list and go get all 20 and throw them all at your poor animal. And don't be so frantic about things. Like, is this a life or death situation? Well, sort of, but this tumor didn't appear yesterday. He's got 5 of them, for God's sake. They've been cooking for a while. I know they've been cooking for a while because his tongue has looked like crap for a while.
Well, and that's a really amazing thing, because I have an old English bulldog who hangs his tongue out, and sometimes it turns almost like this red bluish tint. And I've talked to my vet about it. I'm like, that is lack of oxygen. That is a red flag to something not going right in the body. And then he'll go back to normal and look normal. And in the back of my head, I'm like, what is this? And then I watched your thing with George. I'm like, I need to like dig deeper here.
Yeah. Well, it's interesting because since I've started George on his regimen of a million things, poor guy, today was the first time he looked at me and he goes, really? Because he's a foodaholic. So I can pretty much put anything in there. And today he was like, I'm not so sure, but he ate it anyway. But his tongue is actually looking better. So yay. And the thing is, I'm all about quality of life, not, yes, I want him to live to be 27, but, and I say that tongue in cheek, but I'm all about quality of life. And the thing with this guy, like the thing that might do him in, unfortunately, would be inability to urinate.
Right.
And his brain is just, he's got so many comorbidities. He's got mitral valve disease. He's got paralysis on his face. He's got dry eyes. He's got this, that, and the other thing. None of that matters to him. He's happy. So it's sort of like, yeah. But if I have to make a decision based on he can't pee and everything else is still like his little brain is all happy still, I'm going to struggle with that. So I've been looking up, can we get a stent placed? They actually do them now. So that's kind of interesting, but it's not, can it be done? Can I find someone to do it?
Right. Or if there is a better way. I did lose a dog who had a meningioma. We did the surgery. The surgery actually paralyzed his bladder. So he looked absolutely amazing. He used a wheelchair. I wish I knew about wheelchairs before I did the surgery. I would have just let him run out his life in the wheelchair and let that tumor do whatever.
Yeah.
But the mismanagement of the surgery and all the bladder expressions and the catheterization, that was his demise. And he was vital.
Yeah. And that's when it becomes really hard for people. So I'll tell you a sad story, and then I'll tell you a happy story. So a lot of people who have been following me for a long time know about our little dog Myra, who was a Cavachon, because we had been doing so much Cavalier rescue that I said, I'm going to branch out. While branching out, I went to a Cavachon. So it was still Cavalier, but I had something else in there. And so we got this phone call right around New Year's. This girl said, well, I bought this dog at a pet shop, 5-6 years ago. And now I got married and I have a new baby, and my husband doesn't like the dog, and he bought a husky puppy, and the puppy torments the dog. And so the dog just hides in the corner in the crate all the time. I said, yeah, I'll take the dog. It's a horrible existence for this poor dog. So she brought her, and her skin was like bright red elephant leather. It was horrible. She was just a mess, ear infections, skin infections. And so the woman, hands me over the dog, and she said, oh, and by the way, she pees on the carpet for spite. And I went, oh, now we know why we're getting rid of the dog, because she pees on the carpet and the husband doesn't like that. At least the woman was smart enough to give the dog to a rescue rather than, doing something stupid. So of course she had bladder stones, and she had all this skin disease and everything else. And now, knowing what I know, little leaky gut, we didn't know about that then. So for 2 years, I fixed her. I put her on a homemade diet. Her skin was beautiful. She had a beautiful coat within 6 months. The happiest little dog. I love this little dog. And almost 2 years in, she started vomiting and ended up having lymphosarcoma of the bowel. So it came on like that. She was fine one day, and the next day she was in surgery, and the surgeon said to me, because I had already done one surgery on her because I thought she had an obstruction. I found a piece of pineapple wedged, in her bowel, and I'd given them pineapple as treats. I'm like, guess she didn't chew that one. So I just took it out. A week later, she was doing the same thing. And I'm like, ruh-roh. So I had a friend do the surgery that time. I had a specialist. And he said, yeah, she just had all this inflammation and swelling in that area where you did the surgery. And he said, but I decided I'd go ahead and take a biopsy while we were there. Is that okay? And I'm like, do you want it sent out? And I'm like, well, you got a piece of tissue. Let's see what it is. And he called me a week later. He said, I can't believe this is lymphosarcoma. It didn't look like that at all. Like, we were both stunned. And within a week, she wasn't eating. So of course I do my whole protocol thing. I'm like, all right, I'm going to make a diet and blah, blah. Within a week, she couldn't eat. And I went, well, this is not good, because if you can't get nutrition into your cancer patient and you can't get the supplements into the cancer patient, yeah, kind of got a dead end road. So it's the only time in my life I've ever said, we're going to do chemo. And at week 4, they did an ultrasound and she's clean, absolutely clean, no cancer. And we went home and had champagne and did our happy dance. And I said, wow, this chemo thing is pretty good. I'm feeling good about this. And, the poor dog had already had a couple surgeries. And so the next week we went back for our next checkup, and she had 3 new tumors in a week. And then she developed them in her airway. We ended up having a tracheotomy because she couldn't breathe. Because I'm like, this dog is happy as can be. She recovers from surgery within 12 hours. Like, woohoo, I'm ready to roll. So I said, all right, we're going to go for it. And at 8 weeks, we had to put her down. And I said, never again with the chemo. Like, we trashed her body. We wrecked her. High doses of steroids. Her body didn't have a chance to do it. And it was just to me, it was kind of one of those, well, she couldn't eat. So I was, my options were so limited. So that's my sad story, but I'll give you a good story. So also fairly early in my career, I had a really good client. They rescued standard poodles, not really rescued. They would take breeding females from really high-end breeders when they were done breeding, and they would adopt them. And they had just these gorgeous poodles. And so they brought one to me. She was 7 or 8. And I had been seeing her for a couple of years, and they said, well, she's got this swollen mammary gland. And it was in the worst place. It was the very last one. Like, you never want a mammary tumor back there in a dog. Like, you want them up front. In cats, they're just bad news. But so I looked at it and I said, oh, it's got this discharge. It's swollen. We could try treating it like it's, clogged, abscessed, whatever. In the back of my mind, I'm going, this is bad. This is a cancer. This is bad. But I'm like, all right, we'll try something first. Of course, it didn't do anything. So a couple weeks later, I said, all right, let's get this thing off. We're going to remove we basically did a lumpectomy. And so we got it back, and it was nasty mammary carcinoma, like high grade, nasty. So the woman looks at me, and they're raw feeders, they're holistic. And she looks at me, she goes, what are we doing about this? And I went, I'll get back to you on that. So again, this is very early on. We didn't have a bunch of stuff in our toolbox. And if they had gone to an oncologist, which she said, I'm not, because I'm not going to do radiation. I'm not going to do chemo. Why would I even go? If she had gone, I know they would have done more major surgery. Like, they would have gone in and stripped out all those lymph nodes. They would have gone in and taken out the rest of that mammary chain. We didn't do that. We already knew that it was in the lymph nodes just from the biopsy from surgery. And they're like, yeah, we're not doing all that. Okay. So I don't even remember what herbs I put the dog on. It was probably similar to my mast cell tumor dog, except that my Chinese herbs, I'm sure, were something different. That dog also died at 16 of old age, things totally unrelated. And it was like every time they'd bring the dog in for something, I was like, wow. Like, and I part of it, sometimes I feel like if you don't get so into your stuff and I just have faith that this thing it's going to follow my rules. It's going to do what I need it to do. We tweak things a couple times with her, and sometimes they'd come to me and they'd say, do we have to keep doing all these supplements? And I'm like, well, you don't have to, but it seems to be working and things aren't coming back. So do you want to risk it? And they're like, yeah, we'll take more supplements. So
You know, that's such a good point, because I've had some successes and then the owners backed off on supplements. It came back and then it was totally resistant.
oh, they are like you dip, like,
It mutates, it overrides, it does.
I'm like, you know what? You had it just in check. And if what you're doing is keeping it in check, then let's go with it. You know, let's just ride that out. So, I mean, I think some people think I'm crazy because every once in a while I'll do a Facebook Live and I'm like, here's my basket of supplements for the morning for my dogs. And here's my basket of supplements for my, for the evening for my dogs. But, I most of my dogs are rescues that didn't come from great situations. And I'm like, if I can give them a little CoQ10 or a little omega-3, from a good source, or now I'm using the PEA on everybody, but they need it for other reasons as well, because they all have syringomyelia and caudal occipital malformation syndrome. But if I can avoid drugs and I can use, turmeric and mushrooms and things that are going to keep them healthy, like I think George may have had this thing cooking for a very, very, very long time. And the only reason it hasn't been a bigger problem is because he has been maintained on a lot of these things that I know are constantly fighting the bad guys out there.
Dr. Judy, do you still use IP6? Nobody talks about it.
I put George on it. I went through my cabinet. And Gwen's dog had a mast cell tumor on her tail. And so she had the tail amputated. How long ago, Gwen? 2 years ago? A big dog, 80-pound dog. So they amputated the tail. And so she went in to have an ultrasound done 2 weeks ago, just for monitoring, just to see how things are going. And unfortunately, they sedated the dog. So they said, well, she's got an enlarged spleen. I'm like, yeah, is that because it's enlarged, or is it because the dog was sedated and the blood is pooling? But, who knows? So I said, well, let's go ahead and put Mila on some of the herbs. And, she uses a lot of the supplements anyway. So I was going through my cabinet of all of my baskets of things I'm not using right now. And I found IP6 and I found artemisinin, and I went, yeah, I think George could use these. So yes, I pulled it out and I put George on it. So it's just in his long list of things that we're doing.
Yeah, nobody talks about IP6. When my dog was, my American Bulldog was going through his meningioma, it didn't respond the same as normal cancers. Like anything that I'd used in the past didn't respond to that. It was pretty benign and it was just encapsulated in the spinal cord. So it was super frustrating. And I looked for IP6 info for dogs. I couldn't find it, but I've heard,
I just use the human.
yeah. And I've heard a couple stories now about people turning around or managing their dog's cancers with IP6.
My mammary dog, I know that she got artemisinin, IP6, mushrooms, CoQ10, CBD, like that just sort of is like, yes, here, like we can't hurt anything with these things. And we might do some pretty good damage control. And I have had a few clients. I had a client with, this is another good success story. I had a client with, dog had an osteosarcoma, I think it was osteosarcoma on the rib. And this was a high level agility dog, border collie, I think. And she did have surgery to remove it. She did do the whatever the oncologist told her to do. So there was some chemo, radiation, whatever. But then she came to me and said, okay, I need a diet. I need supplements. Like we got to, make this stay away, because they usually don't. That dog recovered so well. It never came back. And he got to go to Westminster as one of the and was like the top masters agility dog years and years later as an old timer. She sent me a picture. His picture sat on my desk. It's in my office at home now, but it sat on my desk for years because she was like, I'm so grateful. This dog was able to continue doing what he loved doing with a cancer that the prognosis was horrendous.
That's incredible. Now, do you think would you call that a cure? like somebody once posted on this page, you don't really ever cure cancer. And I had to think about that because I've seen what I thought was cures. And I was like, were they cured or were they not cured?
That,
Are we
I mean,
just-
that's a good question. That, you know, when like my mammary cancer dog, I can't say that she was ever cured because we didn't get all the cancer, but did the cancer just sort of die off? Did the body take care of it? I don't know. I wasn't willing to have her stop the supplements to find out. My little mast cell dog, was the dog cured? What do you consider a cure? The tumors didn't disappear, but they also just sat there very quietly. So, and the dog died of old age of something unrelated. So what do you call a cure?
Right, exactly. Well, and that border collie, that's an incredible story.
Yeah.
That's
That was
amazing.
great dog. I mean, great owner. She went to the ends of the earth. I had another one with lung cancer. And so we did protocols for her. I think she had it surgically removed and then no chemo or radiation. And she was the first person who emailed me and said, what about fenbendazole? So, because I had talked to her, we made up a diet and we protocol of herbs and things. And I said, this is when they first started talking about it. And I said, well, I haven't used it yet. I said, I can look up some doses for you. I can try to figure this out for you. So I helped walk her through it, and she's in dog's lung cancer completely gone. We'll call it cured, and it never came back. And so she thought that was a huge help for that particular case. I have not used it. Will I use it for George? I don't know. I haven't gotten to that point of saying, do I need to add that in too? I think I'm going to wait for some more of our testing to come back and talk to Kendra and say, okay, what do you got? She actually wants to inject mistletoe into the tumor. Scares the poop out of me because I'm like, that tumor's sitting there really quietly right now. Do we really want to make it mad? So I'm throwing that ball in her court. IV vitamin C therapy, very popular. She does a lot of that. So we haven't started that yet either, but there's so many things out there, and it's impossible. Like I see these groups and they're like, people do post their success stories, like particularly hemangiosarcoma group. And then when you read the success stories and you look at them, some of them are on diets that I'm like, I would never use that diet. And they use, like, everybody uses a different protocol, especially when you're the pet owner and you're doing it yourself. It's like, I don't have anybody to hold my hand, so I'm just gonna, somebody said this works, I'm gonna throw this and see if it sticks, you know. No two of them have the same protocol. And so you see these dogs, some had their spleens out, some didn't have their spleens out. Some of them, it wasn't a splenic tumor, it was somewhere else. And you look at some of them and they're like, I got 19 months, I got 3 years, I got 5 years. And they're all over the place. There is no one size fits all. And some of them, I look at their protocols and go, there's no way that should have worked. Like, there's nothing I see there that tells me this was a good cancer protocol. Worked for that dog.
Isn't that amazing?
Sometimes you just have to go with your gut and say, well, you know, I'm the pet owner. And believe me, we all have that intuitive ability to know what they need. We just don't tune into it. And we get, like I said, like I instantly emailed Kendra because I was like, oh, I'm in my own way. I can't get out of my own way and think straight. Although I have to say, I wasn't totally shocked by George's diagnosis. So I was out of my way a little bit just because I already was pretty much there. I think didn't prepare my husband well enough, but I never do.
Oh, I'm so sorry, poor man. Oh my goodness.
He's such a bleeding heart too. He'll blubber for days. I'm like, don't you dare blubber in front of that dog. That dog is happy.
So we have some questions in the chat. I think it's Jennifer that was asking about Opuluses, oral Opuluses. What is your thought on that?
They're basically benign. So if you have the small little Opuluses, fine. But then we get these ones that are on the lower jaw that literally want to take over the lower jaw. And the dog looks like they've got a boxing glove or something on the end of their jaw. they're benign, but they get in the way. They interfere with eating. I am a big fan of ignoring them as much as possible. Um, Again, they're not malignant. They're not going to go anywhere else. They're just getting in the way. So, I mean,
I always worry about like secondary bacterial infections.
you can, like if they're pushing teeth out of the way and that sort of thing. I did have a couple of patients that they got so big that they actually ended up having to have the front of the lower jaw removed, but they were rare. Most of them, they would kind of plateau and not get horribly out of control. I think personally that they are antigenic stimulation, like irritation, something is, because they're not malignant. So I think it's just,
Right.
it's a chronic
Like they
inflammation.
chew on a bone too much and irritate the area.
Right. Or, plastic bowl or just inflammation in that area. So my mother's standard Schnauzer, and I had never seen this in another dog, her gums grew up over her teeth, and I thought it was just her gums. Then realized the bone of her jaw, upper and lower, had actually grown over all of her teeth.
Oh, wow.
And so my husband called me, so I was still practicing, called me one night and he said, Shotzi is bleeding all over the kitchen and your mother is freaking out. We live together. And I'm like, well, put her in the car and bring her over. I can't do anything from 15 miles away. So he brings the dog over, and literally this dog was pouring blood out of her mouth. Like somebody had hit an artery. And when you look in her mouth, you can't even see any teeth. I couldn't even figure out where it was coming from. So what had happened, she actually had an abscess in the jaw, I think upper jaw at that point, a tooth had abscessed within the jaw under all this bony growth. And so we couldn't even find the teeth. Somehow I sedated her and somehow managed to find the bleeder. Ended up taking her to a board certified dental specialist, and he dug out rotten teeth upper and lower, but he literally had to cut the bone away. He said, I have never, ever in my entire life seen a dog grow bone over their teeth. So the dog lived to be 17 and a half. For a 50-pound dog is amazing. But we kind of dealt with that off and on for the last year of her life. So when we called the dentist and said, I've got this 16 and a half-year-old dog I want to bring in, she ended up needing 4 blood transfusions during the procedure. It was a mess. I'd never seen that before. And in my mind, it's antigenic stimulation that caused this to happen, but I have no idea why. Dog was raw fed, not over vaccinated, not on any chemicals. I'm like, I don't know. No clue.
Wild. That's so crazy. I love a good mystery.
Yeah, good mystery. Except when it's your own dog, you're like, I don't know. But it didn't stop her from eating, and it didn't, like, the dog was fine. She was oblivious. So yeah, I don't know.
I think that's such a great point, to never really tell your dog that they have cancer, that or any other disorder, and not give that disorder any power.
Right. Like, give it no power. The Myra, the little, the Cavachon that only lived 8 weeks, the day she was diagnosed, we made a bucket list. And so every morning we'd wake up and we say, what does Myra want to do today? It was amazing because my husband and I went to more great restaurants where we sat outside and ordered her turkey burgers, took the dog, and she would always, pick a housemate that could go with her. So the dogs were always in line. Like, I went to Turkey Burger today, but we went to more parks. We went shopping. We took her on a trip to the Orvis store up in New England, let her go shopping for toys. People from all over the world sent her packages with squeaky dinosaurs in them because that's what she loved. And she had a ball every single day. So it was only 8 weeks, but we had a ball for 8 weeks. And so when you approach it from that way, you don't have that regret of, I wish I spent more time with them. I should have done this. If your dog still looks great, or even if they don't, get a photo shoot. Like, take them
I
somewhere,
agree.
get a photo shoot, buy them something fun. Like even Monkey's House, which is a dog hospice and senior sanctuary that I'm the head veterinarian for. When she knows that they are in those very last moments or the last day or two, and she's very good at knowing, that's when she says, okay, now you can go buy them fast food. Now you can go get them chicken McNuggets. Now they can eat ice cream. So there comes a point where you just say, you know, I've been so strict with this diet. My dog hates it. I have to, I have to force him to eat it. It's like, okay, you know what? At some point, you gotta let them enjoy things.
Yeah, I did the same with my American Bulldog that ended up being in a wheelchair. I basically, every promise I had made him that I hadn't fulfilled, I fulfilled it. And he lived a year after the surgery. And we went hiking. He like greeted people all over the world. We
awesome.
went to rivers and lakes and hung out everywhere, and he still played. He loved the lunch whip. So he would grab the lunch whip and actually whip people with it. And he would just chase people with the lunch whip, whipping people. It was awesome.
You gotta let them have that joy. I mean, that's why I get just like, I can't get hung up in going to a million specialists. And like, I think that putting a catheter up George and injecting mistletoe in there, it makes me cringe, because I feel like it could potentially be painful. It could be traumatizing. And I don't want to do anything that inflicts anything bad, unless I know the outcome is like 100%, and that's impossible.
We did have Claudia Costa last month, who talked about mistletoe therapy and her successes. Do you know her?
No.
She's in Brazil, and she uses it in her practice all the time. She trains other veterinarians about it.
Yeah, so it's funny. I had a client with a cat. The client was a homeopath, and she had a colony of cats, and her favorite cat got cancer. And this was many years ago, she had to jump through hoops to get the mistletoe. She had to go to Germany to get it. It was really hard. But man, she did great with that cat.
That's amazing. Well, I guess trust your gut on that.
Absolutely.
Absolutely. We'll keep us posted. There's a bunch of questions in the chat. Somebody's asking about DMSO. What is your thoughts?
I haven't used it. We used it a ton in equine. I can't stand it. As soon as you said it, I can taste it in my mouth right now, because I lived in the equine clinic for a year, and oh man. So, oh God, now I'm going to drool. I used it a couple times for dogs for spinal problems. It's not that popular in small animal medicine, but I have not used it as far as cancer at all.
Well, it's probably a significant option to steroids.
Well, I hadn't considered using it in place of steroids. I mean, it's great for inflammation. I don't know that it has the same immune suppressive ability, though.
It's
and I'm not sure that we want to be suppressing immune systems all the time. So that's a good thing.
Exactly. Thank you. I get a lot of calls. I'm a board certified animal naturopath. I tell everybody I am not a veterinarian, but I'm often a last call, because nobody knew there was people like you, including myself. So now I'm like trying to push people your way or other ways. But if they want me to work on them, I do. And I can actually make house calls. And so I would go to people's homes and see that they're feeding like tap water and very contaminated tap water, and see their lifestyle, which is a perk in that time of crisis to like put yourself in that position. But it's just amazing how the blood work gets missed. And I know that you have like a service that people can send blood work to you. And I don't know that much about blood work, but people will send me blood work, and I'll be like, that's a high platelet count. Like, did you talk to your vet about this? Like, could you go back and discuss this?
It is amazing how many times it's like, yeah, it all looks good. It's like, or not. So yeah, that's why I tell people, always get copies of your lab work. Always, 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 always get copies of your lab work. If nothing else, if you've got a notebook or a computer file, whatever, and you've got lab work over the years, when you get something, you can at least, then you see something that's like in the red area, you can go back and say, well, has it always been like this? What did it look like last time? What did it look like 3 years ago? What did it look like when he's a youngster? So you can see trends, which is very helpful. Like I had a woman who called me because her dog's liver values were still in the normal range, but she went back and looked at trends. And every time she got lab work done, the liver values were creeping up, creeping up, creeping up, creeping up, creeping up. And it was at the very upper end of normal. And she said, look, I know you think I'm crazy because it's still normal, but look at the trend. And I went, no, you're absolutely right. We need to address this, because if we wait until, it falls off the fence and now we've got a deep seated bigger problem, like we could have been proactive. So I loved it. I was like, well, this is great. Look, you're being proactive. And so we, did some liver detox and boom, right back down. So
I love that. And so, yes, you guys are pet owners. You have paid for these blood works. You have paid for your x-rays. You can have copies of everything. Be your pet's advocate. It's so important because they are not comparing the trends. I think that is such good advice. And then other questions. Jennifer Lynn says, I have a 15-year-old 63-pound yellow lab with hemangiosarcoma. I was told about union buyout, but was not sure how much I should be giving him.
So Urine buyout, I can tell you how we always used it. 1 capsule twice a day. And I see dosing and how often to give it all over the place, like start, stop. They only use it when they're having a bleed, blah, blah, blah. We would put all of our hemangiosarcoma patients on Urine buyout. The minute we got a diagnosis, they would get it twice a day, every day, nonstop. We never varied from that. The only thing that we did differently is the little tiny red pill that's in the middle of the package that nobody knows about. Make sure you save those. Those are worth their weight in gold. When they'd have a bleed, we would have them use those. And let me tell you how many times that rescued dogs from, who were down having a bleed. And an hour later, they pop up and you're like, wow, isn't that great?
Amazing. Isn't that amazing?
Yeah, that's how we used it.
What is that little red pill? Is it gunpowder?
It's just a super, super, super concentrated Urine buyout. And I mean, it stops that bleed and it gets those dogs up and going. So save those. We had a little emergency bottle of them at the clinic because any person, any pet owner whose pet died that had hemangiosarcoma and they had been saving them, we're like, bring them in. We will make sure that these get distributed to other people who need them.
That is so cool. Like a little union buyout bank.
Yep, exactly.
It's
almost as good as having a blood bank. Much easier
cool
to administer.
And Morgan's asking about, what is your take on ozone therapy?
Well, I think it's great. We didn't have it when I was practicing, but I think it's awesome. I would definitely recommend having it.
I'm actually drinking ozone water right now.
There you go.
Yeah, it still has the smell after an hour. It's maintaining so far. And so yes, drinking it, injecting it, all sorts of different techniques.
Yeah, you can put it in topical creams. You can put it in anything.
Yeah, I actually have a horse product that I have raw grapeseed that I feed to horses, but I ozonate it first. And I believe the oil in the grapeseed captures the ozone and it becomes dosages of ozone therapy.
Cool.
Yeah, and it's working really good. Feedback on that product is awesome. So cool. I know you're into equids too. So yeah. I love that. You're my jam, girl. Anybody else? I have the membership members on too. Did you want to share anything else, Dr. Judy, like red flags or things like that?
Well, I think like with George and with so many of my clients, people would come in and say, my dog's eyes are red. Like, I've got this middle-aged Labrador. I'm here because the dog's eyes are red. And I would look at them and their tongue would be brick red as well. And I'd say, okay, this is eating normally, acting, yes, everything's normal. That's a dog standing there with the lymphoma. I mean, that's a dog standing there looking at me with lymphoma. It's got a toxic tongue, but it's eating, drinking, acting perfectly normal. So be really in tune with your animals. Really watch the tongue, and don't don't look at it after they just went out and raced around in 90-degree weather and they're panting and they're hot. It's going to be red. Know what their normal tongue color is when they're just hanging out. And if you're seeing like bloodshot eyes, definitely be looking at lymph nodes. So many times we get he's got this lump under his neck. Oh yeah, he's got those lumps everywhere. That's not good. Like with George, his tongue went toxic red, and I was like, there is something bad here. So be in tune to what is normal for your pet, because I guarantee you, you're going to get normal lab work back on those. And that's why you have to be, I mean, George's lab work was normal last week. His urinalysis was pretty normal last week. And I'm like, no, we got to keep looking, because I know there's something here. And you know your animals. So when they're acting not quite right, it's like, stick with it. Like really stick with it, be persistent, and say, no, I know something's not right. We got to find it.
I think that's wisdom. My sister who passed from melanoma, they called me or the house the next day and said, good news, Melissa's blood work is perfect. I'm like,
good news.
Yeah, good news. She died yesterday.
Yeah.
Like, how do you justify it? Blood work doesn't show cancer normally, unless it's certain types of cancer. There's some little.
I mean, you want that blood work. You want to know what's going on, but they are coming out with a lot of very specific cancer tests now. So we use VDI labs a lot, where they, they're looking at things like inflammatory markers and that sort of thing. And they give you a cancer risk assessment that you can look at. So it's kind of nice to do some of those things, but they actually are coming up with really good testing now to diagnose GI lymphoma, but you're not going to get it on your normal chem screen. It's these specialized tests where they're looking for specialized markers. So it is getting better, but if you go into your veterinarian and go, I just know something isn't right, and you just get your normal blood work, so sometimes, and I think veterinarians a lot of times are too afraid to spend your money on testing that might not give you any kind of answers. A lot of them don't know about the newer cancer tests that are out there. There's new ones coming online all the time. So you kind of have to do your research and know, like Texas A&M is coming out with a couple of really good ones for lymphoma. So
How do you get a hold of those? Like, can I go to my normal vet and go, I want to do the Texas A&M lymphoma
cancer testing? Yeah. I mean, that it's available. Anybody can go on the Texas A&M website and look at their different diagnostic lab tests. And any veterinarian can send the lab work in, but they just may not be aware of it. So there's just new tests that they're developing all the time. And unfortunately, this university might have this test and this private lab might have this test, and, so finding all of them. But frankly, it's at the point now where if you just did an internet search and said specialized blood test to detect canine cancer, you're going to come up with a bunch, because there's so many new ones out there.
Okay, that is great to know. If you guys on the Zoom want to ask questions, go ahead and unmute yourselves and turn your screens on if you would like. And then I'm going to read a few more. What do you think about reverse osmosis or alkaline water for your pets?
Haven't used it.
I'm gonna say I'm an advocate against it so much, you guys. So I think RO water is totally depleted in minerals, and alkaline water. The dog that I had with the catheter in him, I did a little experiment and gave him a little alkaline water. His volume of urine output was insane. I was changing his catheter bag every hour. He was filling it up so rapidly. I don't think it's healthy. I don't think we need alkaline. I think we need right in the middle. So
I would agree. I would agree.
Absolutely. So Jennifer Lynn says, oh, she said the red pill. Do you give them one or more at a time?
Usually you give one. So if your dog is having a bleed, or you're pretty sure your dog is having a bleed, or your dog goes down, or their gums suddenly go white, you give them the little red pill. Wait about 15 to 30 minutes and see if they start pinking up and popping up. If they don't, you can give them a second little red pill. And by that point, you should have been on the phone to somebody going, I think my dog might have had a bleed. But I'd have a lot of times the clients would call and I'd say, did you give a little red pill? Yes, I gave a little red pill. How's it doing? He's looking a little better. Okay, call me back in 20 minutes. 20 minutes later, oh, he's up walking around. Tongue looks pink. He's looking pretty good. So, so you just kind of keep them quiet and know that they're going to be off a little bit for a couple of days, and keep an eye on them, because if they have one bleed, they could have another. But yeah, it's pretty good stuff.
Morgan's asking, what would you do for an elevated SDMA in a dog with lymphoma?
Depends how elevated it is and what the creatinine looks like and what the urine looks like. Like, there's so many, like SDMA. I hate the test. It kind of depends how elevated it is. What I would say is, okay, well, maybe that dog is having some kidney issues, which we know lymphoma can affect the kidneys. Do I have to do any diet changes? I don't know. How high is the SDMA? How high is the BUN? How high is the phosphorus? Do we have to restrict phosphorus? Which is the first thing I would do if it even needed to be done. I'm not a fan of restricting protein. And it depends what diet the dog's on already. If it is the dog on a keto diet, is the dog on a raw diet? So there's way too many variables there.
And then I did catch your Facebook Live about your eye reading. I'm an iridologist, so I was excited to see that, but it's also so different than iridology. And so you mentioned the bloodshot eyes, which I have seen in horses that were dying, like this salmon colored around their sclera, and I've photographed it and kind of made note, and I've seen at least 3 of them that were, whether it was colic or a neuro issue or something else that was intense pain, that you could see that this was going super south. So eye readings are amazing.
Yeah.
They're insightful, right?
Yes, don't overlook what we're being told.
And even like that gray blue kind of film on an animal or even a human's eye, I always see that. I'm like, your dog is sick, your animal's sick. And they're like, no, it's not. I'm like, it's got a little tint to the eye that's a little off. What are your thoughts about that?
Yeah, I mean, if we look deep enough, we'll see changes in everything.
Yes, exactly. And you can be pre-crime, you can be pre issues and be ahead of it if you know your pet well. So Julie's saying she has reverse osmosis at home. So is that bad? You use 0 water filter for the dogs. Any recommendations? You just have to add minerals to it, because it's depleting the mineral content, but it's clean water, so that's good. Yeah. Dr. Judy, thank you for your time. This was amazing. I'm so thrilled that you have had these animals live to 17. I have to ask you, what's the longest dog that has lived in your care?
19.
19.
Yep.
Okay.
We adopted him at 8. And he only had 5 teeth, which were rotten. He had horrible arthritis. But he was an ex-puppy mill breeding dog, but he lived to 19, and he was amazing. We had another one that we adopted at 15 that lived to 18. I mean, most people don't adopt 15-year-old dogs, but like, well, why wouldn't you? So we'll see. My youngest, we adopted when he was like 14 weeks old, which I haven't had a puppy in forever, and he's now 2. And he's basically unvaccinated, raw fed, no chemicals. So although he does have a bunch of genetic issues, so it'll be interesting to see how long that guy hangs out. So we'll see.
On that pup, will you do fecal harvesting?
Haven't really thought about it.
That could be a gold mine for you. One more thing to add to your store.
Yeah, right.
It's time, Dr. Judy, because I want to do a fecal microbiome transplant for my Bulldog. He has a lot of genetic issues. He sounds so much like George, but he's only 5. He has neurogenic KCS.
Mm.
He has, he was a retained testicle dog. He holds his tongue out, has a little swollen lymph gland that comes and goes occasionally. So I'm keeping an eye on that. Lots of allergies, but, I don't want to give female, I've talked to my vet about it. I know Dr. Margot has female fecal. I want to do male fecal. Is he intact? I'm assuming he's
My
intact.
little guy's intact. Yeah.
Okay, I'm first in line for your dog poop. Absolutely. Can I please have some?
Tell me where to ship it.
Okay.
He gives us
Awesome.
plenty. And the funny thing is, George is a total poop eater. So he's doing his own fecal transplants all the time.
There you go. He knows best. Right on. Thank you for your time today. What
All
a
right.
delight. We all
Thank
learned
you.
something. We're better people from this moment on. Thank you
Thank
very
you.
much.